being a patient in America's healthcare system is complex, and what the term that we use and the term that's being motivating for our health systems around the world is health literacy. How can we make the demands and the complexity of the system simpler and at the same time get people to make decisions that are appropriate for their own health and well-being? 151 absolutely is way too many. I think we need checklists of fewer than 10 things that people can do each day, and then when it becomes a ritual or a habit, that will make the difference. And that's really what wellness is about.
There are 4 things that have major impact that cost 75% of our healthcare system. So we could get rid of a lot of Johnson & Johnson's bottom line and save the government $1.6 trillion. The U.S. governments, if you did it at the state level as well as the federal. Tobacco, food choices and portion size, physical inactivity, and managing stress, or if you will, the converse of those. So if we just did those 4 things, and that's what Real Age, and that's what Johnson & Johnson's scorecard does too, is it lets you know which is most important for you.
And it's a great opportunity for people to understand, if you know your 4 risk factors, if you know certain clinical features such as your blood pressure, your blood sugar, and cholesterol, and you are able to manage those, frankly, with both physical activity as well as potential medicines, and some of these are not expensive medicines, but interventions that will make a difference. People will have healthier lives, and we will save the system money.
What's fascinating about Johnson & Johnson is part of your mandate then is to change people's behavior. I mean, you're changing people's overall health that may or may not have a benefit to your bottom line.
Absolutely.
Right?
Absolutely. Prevention is good medicine for everybody.
For everyone.
The other bottom line is we want to reinforce good behaviors, as you're mentioning, flossing, rinsing, and so forth, but we also want to change people's behaviors that are not so good. So we make smoking cessation products, for example, ex-US. So there are opportunities for us to both educate and also give people, help them make the easier choice.
Well, let's talk about technology. We're at TEDMED, and innovation technology is something we think about. What are you seeing the opportunities with technology to improve our health? I mean, besides going on a website and finding out my real age, are there other sort of innovations coming down the line we should be looking at?
There really are 4 steps we found at the Cleveland Clinic in changing our employee population health. The first is giving people aha moments and changing the culture. What do we mean by that? If he can get thin and healthy, I should be able to do it. That's the major aha moment, but it's an expectation that we're going to live. Secondly is changing the environment, so it fosters you being healthy. It's hard to be unhealthy in that environment. We take out, in fact, all sugared beverages, and the vending machine changes, the patient food changes, etc. The third one is where technology, getting social media, social buddies, using individual buddies, using e-coaching, online programs to sustain that. And then the fourth, we use large incentives to keep people or to sustain the change. Well, if you're at the beginning of the year, you get a charge for your health insurance. We rebate that charge if you have 5 normals. So what are the 5 normals? They're normal blood pressure, normal lipids, normal hemoglobin A1C or normal glucose, normal waist for height or BMI.
So you pay people to be healthy, basically.
We pay them an awful lot. That's why I said large incentive. So it's $2,000 is the difference between that rebate or not.
And out of those...
But there's a lot of technology involved, right? Not only are you getting those measured, but you're automatically pulling those data and validating those data from the EMR, and you're getting a system that promotes health by changing the environment.
And what's interesting about what we're trying to do is we're also reaching the consumer. We're not talking about technology just for the physicians or just for the health intermediaries, but the consumer. So what does a woman do when she wakes up and she's pregnant in her 8th week? She can go to a website that we have called Baby Center, or she might work with Text for Baby, which is a text-based program with the U.S. government, the White House, and actually 500 groups under Healthy Mothers, Healthy Babies that we help start to give her personalized messages, to remind her to get her flu shot, to remind her for prenatal testing, and all these other issues that are there.
Okay, last question. Are you an optimist or pessimist about the future of health and healthcare in America? Optimist or pessimist?
Do I only have to give you one word? I'm a total...
One word with one sentence to support it.
Optimist. 75% of our healthcare costs can be controlled by changes we make if we don't make them. If you were a pessimist, America goes down in its freedom and we get rationing. So, I am an optimist because I think we will make those changes before they're forced on us.
You do.
That was longer than a sentence. I'm an optimist because I'm an optimist at everything. However, I have to be patient. This system is not a system. This system leaves 30 million people below the line where they should be. This system is not like it could be, and we have to be optimistic, but we have to be patient. We've got to look at prevention, but we also have to realize that we can't look at the current health system for the solutions, and we can't only look at government. We need partnerships. We need people such as yourself helping push this message out, the media and others. I mean, all of these are really important players.
It's all hands on deck problem, and if it doesn't, it's going to sink the country. Really,
Right.
it's going to sink the country. I want to thank you for your time
Thank
and
you.
for both what you do for our health. It's been fantastic, and we've got a lot of checklists to go figure out. We've got 5 and 4, and no four-legged animals, so I really like it. Thank you very much, Scott.
Thank you.
Thank you.
Thank you.